Hi, welcome in. My name is Dr. Rose. It's a pleasure to meet you. Now, just take a seat and make yourself comfortable. I am just going to grab the details of your visit in my notebook here, so please excuse me. Okay. Yes, it's raining quite heavily outside, isn't it? Where are you? Here you are. Can you just confirm your full name? And your date of birth? Fantastic. A contact number for you? Fabulous. And the first line of your address? That's great. Okay, so as it seems, we're just doing a general health check on you. I can see that you've had a cranial nerve exam in the last few years. So we'll kind of perform a mini cranial exam, not quite as intensive as a full comprehensive cranial nerve exam, but we'll cover the basics for you, okay? Alright, I'm just going to grab my other notebook here and my pen. So please tell me, do you have any ongoing concerns at the moment? Okay. And any pain at all? Have you sought any other methods in terms of your recovery? So that could be physical therapy, visiting a chiropractor or masseuse that specialises in, say, sports massage. Okay. Do you have any medical diagnoses? Okay. Are you on any medication or supplements? Okay. Alrighty. Are you pregnant? I have to ask. Do you smoke or drink? Alright. That should be okay for now. Like I say, we're not doing a full cranial. It is more of a mini medical exam. Alrighty, so I think what we will start with, just being mindful of everything that you have told me, I will just first take your temperature. I'll also have a little listen to your heart rate and your take your blood pressure as well. So what I need you to do is just pop this thermometer under your tongue. Thank you. We'll leave that there just for one moment. Would you be able to just hold? Thank you. It will give us a little beep when it is ready, so, and I'm just going to get the cuff for the blood pressure ready. Which arm would you prefer? This one? You're right. Okay. Are you right-handed? Alright. Beep. Okay. Temperature is fine. Yes, we don't need to worry about that. Okay, so I'm just going to take this and I am going to squeeze it and it will inflate the cuff. just going to do that once more. I do like to take the blood pressure twice just so we do get an accurate reading. Okay, so we're going to re-inflate again. Okay, let's just have a little listen. Excuse me, to your heart rate. Okay, so just breathe normally for me. Okay, just going to move it around. Alright. Okay. Heart rate is a tad high, but nothing that you need to worry about. I mean, sometimes our heart rates naturally rise when we come into a doctor's office just due to general anxieties around being here. Yes. Now I think the next thing we're going to do is just test your vision a little bit, make sure everything is okay there. Now, do you wear glasses or contact lenses? And when was the last time you had your eyes tested? Okay, so what I will just begin by doing is asking that you hold your finger on your nose, and you're going to go between touching your nose to touching my finger, which I will move around. Yes. So if you hold your finger on your nose, and I will place my finger here, so if you touch my finger, touch your nose. So we're just going to repeat that over and over again. Okay. And I will go between moving slightly closer and slightly further away, just testing your perception of depth. It's not a race, you can go as fast or slow as you want. Okay, good. Now the next thing we are going to do is test part of your peripheral vision. So this time I'm going to ask that you focus on my nose. I'm going to hold my hands out like this, and I'm going to wiggle one side, and you need to just verbally say left or right. Or do your left and right, yes, just to make it a bit easier. Okay, so looking at me. Very well done. Again, another peripheral test. I'm going to start with my fingers outside of your vision, and then I am going to bring them round, and I just need you to say when you can see them, okay? I'm going to do one side at a time. Okay, So we'll start with your right side and you just say when. Okay. Good. Very well done. Okay. Okay, and then we'll move to the left. So same process, just bring the finger into your vision and you say when. Perfect. That's great. I'm going to ask you now to follow my finger, but I need you to use only your eyes. We're not following with the head as well, so just the eyes. Okay, so we'll start here. I'm kind of just testing all points of your field of vision, so up, right, left. My gosh, I'm getting confused myself. Up, down, left, right. Yes, and kind of the corners as well. Is there any pain at all in your eyes when you're looking up or down? No? Okay. So what I would ask is we're going to do the same. Excuse my chair, it's very creaky. We're going to do the same up, down, left, right. And when we are doing certain directions, I am going to be just touching your face in certain places, more so around the eyes. Yes, I will just pop some hand sanitizer on before I do touch you. If you would prefer, I can put some gloves on. The hand sanitizer is fine. Good. So if you can look up for me, I'm just going to pull down on your lower lid. Okay, and the other eye, excuse me, just keep looking up. Okay, can you look down? And now I'm going to pull on the upper lid. Okay, the other eye. Good. Can you look to your right? Okay, now look to your left. Alrighty. Do you have any sensitivities to light? No? Any trouble driving at night time? Okay, so we are going to skip out on the light exam. I just don't feel that's necessary at this point. And if you did find any concerns with your vision further, again, we'd probably recommend you book in at the optometrist. Okay, I'm just going to do a quick sensation test, so your sense of touch. I'm going to ask you to close your eyes and I'm just going to tap you on your face and you say when you feel my touch. Okay, now I am going to use the back of my hand and I'm just going to use a nail, not the pointed end, just the surface face, and I will give you an example of what this feels like, okay? Alright, so now close your eyes and you tell me when you feel my touch. do a nice big smile for me with your teeth exposed? Now with your mouth closed. Can you raise your eyebrows? Can you frown? Can you pout your lips? Okay. Can you open your mouth nice and wide for me? I'm just going to ask you to do that again, but repeat the motion. Like, I'm going to feel your jaw. So open and close. Do you grind your teeth at night? Okay. Now, it's not entirely unusual, but you do have a little bit of crunching when you open and close your jaw. I have the same as well. Do you have any conditions surrounding orally, so dental or the jaw? Okay, that's fine. Okay, now just testing your resistance. I'm going to place my hands on your shoulder, and I need you to try and keep them up, and I'm going to push down. Okay, so I'm going to push. Good, and now relax. We're going to do that once more. Excuse me. I have a habit of just touching my hair. Okay, and again, so we're going to push. Super. I'm going to place my hand on the side of your face, and I'm going to push, and you need to resist that. Okay? Is there any pain when we're doing that? Okay, so we'll just do the same again. I'm going to push this side and then this side. Okay. Can you bring your arms up like this for me? Okay, now I want you to keep your forearms as tucked to your chest as you can, and I'm going to try and pull them away. One arm at a time, of course. Good, and this side. Okay, now I always repeat the exam twice, so. Okay. Good. How much tummy control do you have, or core control I should say? Are you able to extend your stomach, so push your stomach out? I'm not going to touch you on this part, I'm just trying to see. Okay, and are you able to suck your stomach in? Can you really kind of tense your core for me? Okay. That's okay, yes. Alright, can we just, with your legs, can you sit a little further back into the chair so your feet aren't quite touching the floor? Okay, and I need you to lift your thighs. You are able to stabilise yourself by placing your hands either on the arms of the chair or kind of just behind you here. So lift your thighs from the chair, and I'm going to push down, and you need to try and keep them up, okay? Good, now relax. We are going to do that again. Okay. Okay, good. That's fine. You can relax again. Make yourself comfortable in the seat, however feels right for you. Now I'm just going to take my little tool here and test the reflexes in your arms and your legs. So I am going to start at the elbow. Good. Fabulous. And the wrist here. Good. Perfect. And now we'll start with the knees and we'll also do the ankles. So just your first knee here. Again, if you can sit back a little bit. Thank you. Good. And the ankle. Perfect. Left knee. Good. That last one was a little stubborn. Okay, so we're almost finished. I do just want to test your hearing and also your sense of smell. So what we will do is 2 exams for the hearing. I'm going to first do soft sounds beside each of your ears. I need you to close your eyes and then you tell me which side you are hearing the noise. So yes, it sounds like very subtle. And the other, I am going to ask you to again close your eyes, and then I'm going to pop some earphones into your ears, and we do have a microphone which we can speak directly into, and I need you to tell me which side it is coming from. Okay. Right. Yes, so we'll start with the soft sounds. So close your eyes for me. Okay, good. Now, just got to unwrap these. I'm just going to pop these in your ears. You're welcome to adjust them yourself so they're comfortable. Okay, excuse me. So I'm just going to come to the microphone just here, and I'm going to whisper a sequence of numbers which I need you to repeat to me. Eyes closed. 1, 2, 3, 4. Okay. 9, 8, 7, 6. Mm-hmm. 2, 4, 6, 8. Okay. 3, 6, 9, 12. Okay. 4, 3, 2, 1. Okay. You can take the headphones off now. Thank you. Okay, so for sense of smell, we have these little pots that have a scent inside. I'm going to open the pot and then ask you to smell, and you tell me what it is that you think. Okay. I'm smelling them because I'm making sure they're in the correct like labelling in the container here. And then the last one, this is the one that people find a little more tricky. Yeah, amazing. Well, you did fabulously. I can't seem to find any concerns with regards, to any of the areas that we tested. The only thing that we would obviously ask you to be mindful of is the injury you said you had, and if you continue to, if it is reoccurring, I know it is feeling a bit better at the moment, but if it does reoccur, come back this time and we will have a little look. Yeah. Well, especially when it's a reoccurring injury, we don't want it to turn into something that could be more severe. Okay. You're very welcome. You take care as well.